1,2 million de personnes ont besoin d'une assistance humanitaire. Les conflits persistants et l'insécurité alimentaire rendent la riposte plus difficile. La mobilisation communautaire reste essentielle. L'expérience montre que des flambées de ce type ne peuvent être maîtrisées que lorsque les communautés sont pleinement impliquées dans la riposte. Un développement positif, pour conclure sur la RDC, est également à signaler que le 27 mai, un patient a guéri et a quitté l'hôpital et a été déchargé dans la communauté. Je vais passer à l'Ouganda. Le 15 mai, l'Ouganda a signalé un cas confirmé chez un patient ayant voyagé depuis l'Ituri, en République démocratique du Congo, pour recevoir des soins en Ouganda. Au 27 mai, 7 cas confirmés, dont un décès, ont été signalés en Ouganda. 3 de ces cas ont été importés depuis la République démocratique du Congo. Les autres sont des cas contacts, y compris des agents de santé. Tous les cas en Ouganda sont actuellement liés par des liens épidémiologiques et il n'existe à ce stade pas de transmission communautaire documentée. L'OMS aide les autorités ougandaises à garantir la mise en place des mesures principales de riposte. Je vais passer maintenant au contexte global. Le 19 mai, le directeur général de l'OMS a convoqué le comité d'urgence du règlement sanitaire international qui a émis des recommandations temporaires le 22 mai. Ces recommandations soulignent l'importance d'une lutte coordonnée contre la flambée, d'une forte collaboration transfrontalière, d'une surveillance soutenue et de la solidarité. Sur la base des informations actuellement disponibles, l'OMS ne recommande aucune restriction en matière de voyage ou d'échanges commerciaux avec la République démocratique du Congo ou l'Ouganda. Enfin, l'OMS a réuni des experts mondiaux pour examiner les traitements et les vaccins candidats. Plusieurs produits candidats ont été identifiés pour des essais cliniques. Pour le traitement, 3 candidats thérapeutiques sont priorisés pour les essais cliniques. Les anticorps monoclonaux MBP 134, le maftivimab ainsi que l'antiviral remdesivir. Pour la prévention, l'antiviral oral obeldesivir est priorisé pour une utilisation post-exposition chez les contacts de cas confirmés dans le cadre d'essais cliniques. En outre, 2 vaccins candidats ont été identifiés pour évaluation dès que des doses deviendront disponibles. L'OMS travaille en étroite collaboration avec les gouvernements des 2 pays pour soutenir l'évaluation de ces contre-mesures médicales, tout en augmentant en urgence les capacités de prise en charge afin de garantir que tous les patients aient accès à des soins de soutien optimisés qui peuvent sauver des vies. Comme on l'a observé lors des flambées précédentes, les mesures de santé publique fondamentales, comme la surveillance, la recherche et le suivi des contacts, la détection précoce, l'isolement et la prise en charge des cas suspects et confirmés, les mesures de prévention et de contrôle des infections, ainsi que les enterrements sûrs et dans la dignité, sont efficaces pour interrompre les chaînes de transmission lorsque les communautés sont pleinement engagées aux côtés des autorités sanitaires. Ces mesures seront à nouveau essentielles dans cette riposte. Je vous remercie. Yeah. I'll do that very briefly before we take questions. So let me switch to English very shortly. So to summarize the situation in the Republic Democratic of the Congo, as you know, on 15 May, the Ministry of Health of the Democratic Republic of the Congo notified WHO of a Bundibugyo virus disease outbreak. As of 28th of May, a total of 125 confirmed cases have been reported, including 17 deaths in 13 health zones in provinces of Ituri, North Kivu, and South Kivu. 16 confirmed cases are healthcare workers. There is a total of 906 suspected cases, including 223 deaths that are currently being investigated. Investigations are ongoing and this figure will change while testing capacities are being scaled up. My main point here is WHO supports the Democratic Republic of the Congo health authorities to scale up Bundibugyo virus disease intervention, but also support essential health services through partners, and this includes maternal and child health, treatment of malnutrition, mental health services, trauma and wound care, support for survivors of sexual violence, routine immunization, and community health services. This is to remind you that this outbreak is happening in a very complex context. In Ituri alone, 1.2 million people require humanitarian assistance. Ongoing conflict and food insecurity are making the response more difficult. Turning to Uganda, the health authorities of Uganda notified a confirmed case in a patient who had traveled from Ituri in the Democratic Republic of the Congo to seek care in Uganda on 15th of May. As of 27th of May, a total of 7 confirmed cases, including 1 death, has been reported in Uganda. 3 of these cases were imported from DRC, and the others are linked contacts of those confirmed cases. Moving to the global aspect of this response, as you know, the Emergency Committee issued temporary recommendation on 22nd May. These recommendations highlight the importance of coordinated outbreak control, strong cross-border collaboration, sustained surveillance, and solidarity. Based on current information, WHO does not recommend any restriction on travel or trade with the Democratic Republic of the Congo or with Uganda. WHO brought together experts to review candidate treatments and vaccines, and several products have been identified to be assessed in clinical trials. For treatment of confirmed cases, 3 candidate therapeutics have been prioritized. 1 oral antiviral therapeutic, has been prioritized for prevention, for post-exposure exposure among contact of cases within a clinical study. My last word is for recalling that now we have these candidate therapeutics and vaccine. WHO is working closely with the government of both countries to support the assessment of this candidate medical countermeasure, while at the same time and urgently scaling up care capacities to ensure all patients in those affected communities can access optimized supportive care that can help save lives. As we've seen in previous outbreaks, core public health measures, including surveillance, contact tracing, early detection, isolation and care of suspected and confirmed cases, strong infection prevention and control in health facilities, along with safe and dignified burial, are effective in stopping chain of transmission when communities are fully engaged and empowered. These measures will be critical again in this response. Thank you so much.
Thank you very much. Merci beaucoup, Agnès. We start off with a question in the room from Christian, German News Agency. Go ahead.
Merci, thank you. Si j'ai bien compris, les cas ne sont pas vraiment augmentés comme au début. Est-ce que ça veut dire que le pic soit passé ou est-ce qu'on a beaucoup de spécimens qui doivent encore être examinés? Et encore une question pour Christian. Nicht auf Deutsch. Can you give us an update on where Tedros is, what he does, how long he's going to stay, and what to expect? Thank you.
Merci. Je vais vous répondre en français. Merci de soulever effectivement ce point sur les chiffres, et je pense qu'il y a eu certaines incompréhensions. Ce qu'il faut bien comprendre, c'est que les capacités de test sont en cours d'amélioration. Mais il y a effectivement eu un moment où un certain nombre d'échantillons, pour des raisons diverses, n'ont pas pu être testés directement. Le travail est en cours par les autorités nationales de la République démocratique du Congo pour ce qu'on appelle reclassifier l'ensemble de ces cas. Par rapport à vous dire si le pic est passé ou pas, la réponse est, d'une part, les investigations sont en cours. Je ne pense pas qu'on puisse dire ça à ce moment.
Yeah, and on the whereabouts of the Director General, so WHO Director General Dr. Tedros yesterday left for Kinshasa. He's currently in Kinshasa and will, during the next days, meet local partners, the authorities, and UN partners also in support of the Ebola outbreak of the authorities. Any further travel arrangements we'll update when we have them. Plans are developing.
Thank you both very much. Further questions in the room, online? Okay, we have a couple of questions online. Jérémy Lance, Radio France Internationale. Jérémy.
Thank you, Rolando. Can you hear me?
Yes.
Une question pour Madame Legan. Je voulais vous interroger par rapport au vaccin russe. Le patron du CDC Africa a exprimé donc le fait que la Russie avait manifesté la disponibilité, je ne sais pas si on peut dire ça comme ça, d'un vaccin russe qui serait uniquement destiné à la souche Zaïre, puisque l'OMS a répété que le vaccin Ervebo qui agit sur la souche Zaïre n'est à ce jour pas considéré pour juguler l'épidémie. J'aimerais comprendre en quoi le vaccin que la Russie prétend avoir développé pourrait avoir un effet quelconque sur l'épidémie actuelle. Est-ce que vous pouvez me donner des précisions là-dessus ?
Merci pour cette question. L'OMS invite tous les institutions qui auraient des vaccins qui pourraient être efficaces à bien évidemment partager leurs données. Pour le moment, les groupes d'experts qui ont revu les candidats vaccins disponibles à ce jour ayant des données cliniques ou précliniques n'incluent pas ce vaccin. Je n'ai personnellement pas vu ces données, je ne peux donc pas vous répondre à ce stade. Juste pour rappeler, l'OMS revoit l'intégralité des données précliniques et cliniques pour s'assurer que les bons produits puissent être évalués. Encore une fois, on parle de produits investigationnels dans le cadre de cette réponse pour le bénéfice des populations. Merci.
Nina.
Yeah. Thank you for the briefing. So Nina Larson, AFP. I was wondering if you could say a bit more about the person who has recovered. What can you say about that? What kind of hope does that give? What recovery rate are you expecting to see? And also I was wondering, the numbers you gave, I see there's a bit of an increase in the confirmed cases, but the suspected seem to remain the same since about a week or so. Why is that, and when do you expect to have, how accurate do you think that is? Because I guess that the number of cases is probably a lot larger, right?
I'll start with your question around the numbers first, and then conclude with people recover, because it's very close to my heart. In terms of numbers, what you need to understand is when we have an outbreak, the most important thing is to try and identify anyone who could have symptoms that is suggestive of a specific disease. In that case, Bundibugyo virus disease. As you probably know, the symptoms are not necessarily very specific, especially at the beginning. So it can be thought that it's malaria or something else. That's what we are going to call suspect cases. The suspect cases to be will need to have laboratory testing to confirm whether or not they are indeed infected with Bundibugyo virus. So the number of suspected cases, by definition, is going to evolve. You will have the suspected cases that are tested positive and then become confirmed case. And then you have the suspected cases that will be reclassified as non-case, meaning they have been tested, they didn't test positive, they test negative for Bundibugyo virus, and will be cared for accordingly to their symptomology. So that's why the number is evolving. As I mentioned, there were initially some delays in getting the sample to the laboratories, and the the laboratories in both Bunia and Kinshasa are actively working on testing all these samples that couldn't reach earlier the laboratories. And based on this testing, a number of suspected cases will be reclassified as non-case for the one who test negative or confirmed for the one who test positive. I hope this clarifies. I know it can be challenging. On your on your first question, it's always something very positive that we welcome when people recover from diseases that are very severe. From previous outbreak of Bundibugyo virus disease, the lethality, that is the number of people who died among people who were confirmed for the infection, ranges between 30 to 50%. It's huge. It means like up to 5 out of 10 people are likely to die. So having people who recover tells us two things. 5 people are likely also to recover, and we can do more. We can do more. We can scale up optimized intensive care. We can support the communities to recognize the symptoms early, to get early diagnostics so that they can receive the level of care they need. And also, you know, this disease transmits through close contact. It's a terrible disease because it's a disease that you get when you care for someone. When you care for your husband or your partner or your child or your mother. You get it when you want to help someone who is sick with symptoms. And this is terrible because this disease, to avoid getting it, you have to ask communities not to touch someone they love when they are feeling sick. But this is critical. And what's the most important thing is that we can support them to get early access to care. And when someone recovers, I mean, they go back to their community and there is a sense of hope, showing that early access to care can help save life. There is a life outside of this disease. And what we've done in the past and what DRC has done with really great success is setting up survivor care program to follow any potential sequelae that these people may have and keeping the support that these people may need after they recover. And similar approach will be taken in this outbreak as well. Thank you.
Thank you very much. That was a very thoughtful explanation, but I think Christian wanted to clarify one thing maybe.
Checking the 30 to 50% case.
Thank you very, very much for that explanation. Okay, we have lots of questions online and a couple in the room still, so maybe a follow-up from Nina, then over to you, Olivia.
Yeah, thank you. I wanted to follow on the case fatality rate because the situation report that was published earlier this week showed that the case fatality rate was at 24.6 or so, I think, for the suspected cases. And then for the confirmed ones, it was much lower. But I'm wondering what that says, if you expect that this outbreak actually has a lower case fatality rate than previous outbreaks of this species of Ebola, or if that's just because of the lack of numbers. And I had, just one final question on the, you mentioned that you're not recommending travel restrictions. Italy has just said that they want to restrict access, tighten security around their borders. The U.S. obviously says no one is going to enter the country with Ebola, is really tightening the borders. What do you say to those countries who are, I guess, not necessarily following WHO recommendations? Thank you.
Thank you. For the case fatality ratio, so again, this is very preliminary to have a good understanding and an anticipation of what it will be in this outbreak. As I mentioned, there is still a number of suspected cases that have not been confirmed. There had been also reported deaths that couldn't be sampled, meaning that probably they were confirmed, but they are not including yet in the case count, and we will need further investigation to truly assess that. We cannot as a general matter, just use numbers to define whether or not it's sorry, I will rephrase. The case fatality ratio is always a multifactorial, depending on access to care, depending on host population, depending on pathogen specific. In terms of this virus, the sequences have been released by both Uganda and the Democratic Republic of the Congo, and is similar to what we've seen in the previous 2 outbreaks. So we are not expecting major change. However, we hope that by scaling up all the interventions that are being implemented in the ground, by getting people early access to care, early diagnostic, optimized supportive care, yes, we hope that this case fatality ratio will decrease, obviously. On the travel, as I mentioned, there has been some temporary recommendations that have been issued by the emergency committee. The recommendation is clear. People that are from the affected areas that are either contact of confirmed or probable case or suspected cases should not travel. The recommendation is also very clear. The Democratic Republic of the Congo and Uganda has to implement what we call exit screening measures, which is currently being done. We encourage all countries to be in line with the international health regulation and to follow the temporary recommendation. Voilà.
Thank you. Sorry, thank you very much. Okay, Olivia, Reuters.
Hello, thank you. Just on the case who recovered, so just one case that's been confirmed of somebody recovered. Do we have any, and that was in, sorry, first question is, that was in DRC in the Congo. And secondly, do we have any understanding of their age or profile or something that was it the kind of early access to care that you think kind of led to their recovery? Just any more details about that case would be helpful. Thank you.
So I'm sorry, I'm not here to discuss patient confidentiality data. So I'm not going to talk about that.
Yeah, fair enough. Thank you very much. Okay, we'll go
maybe to ask to say,
please go.
if anything is to share tonight, still we're expecting a disease outbreak news coming out. The dawn, an updated one. If there's anything to share, you would find it in there.
Thank you. Very good, Ms. Christian. Well noted. Okay, turning online, we have 1, 2, 3, 4 questions, starting with John Zarakostas, The Lancet, and France 24.
Yes, good morning. Thank you for the update briefing. I was interested, what's the latest in the field in increasing testing capacity, given there was an infusion of funds from Tom Fletcher towards the Ebola situation in the DR Congo, and also there's funds that the WHO has tapped into. So how many new laboratories are you setting up in the field, and will they have up-to-date diagnostic capacity to pick up all variants? Thank you.
Thank you. Just let me explain a bit further on the diagnostics. So the laboratory in Bunia is functional, up and running, and is able to test on 2 different platforms, able to differentiate Bundibugyo virus from the other filovirus. The issue that we have in the field is not necessarily an issue of resources. It's an issue of access. You may have heard in the news that Bunia Airport has been closed. And we thank the Republic Democratic of the Congo to allow humanitarian flight to still continue to go in Bunia. But access is not fully functional. One day I got a call from my team telling me there is no fuel, or the flight couldn't leave because of the climate, or any single issues. All that is delaying timely and proper access. The lab in Bunia has now been fully supplied with the different PCR kits and is able to do the testing. But then there is still security access from other health zones to bring the sample to Bunia. So first, we are working with the Democratic Republic of the Congo to fix these issues. Also, a close-to-patient point-of-care PCR diagnostic is currently being validated in the field. If the data shows us that it performs well, there will be ability to decentralize the testing capacity as close as possible to patient care. This is work ongoing. Thank you.
Maybe just a bit of broader context, colleagues, to obviously underline that the humanitarian situation in Ituri has really been strained and remains deeply concerning. And if you might have seen reports of killings since early May, at least 150 civilians have been killed in Ituri province alone. So this is really overarching sort of concern, as we've been briefing you on, compounding the situation of Ebola. So we have more questions for you. Back in the room? No, back online then. In this case, we have Jamie of the AP. Jamie, go ahead.
Thank you. Thank you very much, Rolando, and thank you, Dr. Legon. I just wanted to follow up on the situation in terms of when you expect the time frame of being able to get the results back on the number of suspected cases, because I think a lot of people, as my colleagues have already been asking, are going to hear that, in 4 days, we have not seen the number of suspected cases go up from 900, you said 906. So that's going to raise a lot of questions. And I just want to make sure that, that you can be really clear about whether or not you think it means that, you've said it before, but just kind of in passing, but, does this mean that there is, there's still a way to go? You expect to see higher numbers of suspected cases. Could you just clarify, what you think the trajectory of this outbreak is? Thank you.
Okay, I will re-clarify because I think there are still some confusion about that. I'm happy to see, I will say it very bluntly and very clearly, I'm happy to see the number of suspected cases to increase. Why? Because it means surveillance is working. It means we have teams in the ground that are able to early recognize patients who may have this disease. And that's what we call suspected. We think that while the testing is ongoing, and for the exact timeline, I would defer to my colleagues of the Institut National de Recherche Biomédicale in both Bunia and Kinshasa that are working tirelessly, as you say in English, to get all the samples being tested as fast as humanly possible. We are hopeful that most of the backlog of samples that has been reported in the past will be proceed in the next coming days. But then you need to understand that some work is needed to do the case reclassification. So expect this number to change a little. But again, if I see more suspected cases, it doesn't mean that more people have necessarily the disease. We are talking about suspected cases. It means the system works. And we need to encourage that and to follow it as close as we can. Over.
I think that's very clear. Thank you so much, Doctor. A couple more questions. Alina of TASS News Agency. Alina.
Thank you, Rolando. Good morning, everyone. Alena from TASS News Agency. And I thank you so much for the informative briefing. However, my question is meant for Christian, since I have an opportunity to catch him. It is not related to the situation in the DRC, but I hope it's all right. My question is concerning the U.S. withdrawal from the WHO. There previously have been discussions about how the outstanding contributions of the United States for 2024 and 25 stand in the way of the process of withdrawal to be finalized from the WHO perspective. However, this question does not seem to have been raised during the World Health Assembly. So my question is, if you, Christian, could please give us an idea whether the WHO therefore officially acknowledges the withdrawal of the United States from the organization, and considers the process of withdrawal to be finalized or not? Thank you very much.
Yeah, between Congo, let me quickly jump in here. So if you have followed the procedures, you will have seen that the member states discussed that if the US remains further in arrears, voting rights may be stripped off in the next towards the next assembly. That's what they discussed. That's what they decided. That's where we are.
Very clear. Thank you so much. Okay, I think dernière question, Moussa Al-Mayadin.
Thank you. It's not concerning the Ebola topic, another situation. If I
is it for OMS? It's for WHO?
WHO for concerning the situation, health situation in Lebanon for Christian, I think.
Okay, let me just make sure there are no questions for Dr. Lagan. And I think there's still one more question for Dr. Lagan. Let's hold on to that, Musa. Nina, back to you.
Sorry to harp on this. I just want, just on the patient that recovered, this is the first patient you're aware of that has recovered, and could you confirm that? And do you have anyone else who do you expect more recoveries to come in the coming days? I don't know what you're seeing in terms of how patients are doing. Thank you.
Of course, we expect more patients to recover. That's why we are scaling up those interventions. We hope that as many patients as we can will survive. This is what is important about this patient is that he's the first one who was admitted to a care center, who was discharged following 2 negative tests. Of the, I would say, unfortunately, of the person for which the lab results have not been received yet, probably some of them also recovered. And that's why we need this investigation to be concluded, to have the case classification to be concluded so that we can tell you. But yes, we are expecting more people to recover, of course.
Thank you very, very much, Dr. Lagan. It's not doctor. Okay, well, I promoted you to doctor. But hold on a second, because I think we do have, maybe, is this Satoko? Is this for Anis? WHO?
Hello?
Hi.
Yeah, yes, but not about the Ebola. I just want to follow up the...
So we can release you. Thank you very much. Really appreciate your update. And this, Christian, you're still on the hot seat there. Let's go, maybe, Satoko, let me go back to Musa. This is, Musa, your question was on Lebanon, the health situation, but why don't you pose it, and let's see if colleagues could respond to your queries. Go ahead, Musa.
Yeah, just if there's any update about the health situation in Lebanon, especially in south of Lebanon, regarding the last update of the situation there. Thanks. So, Christian, if you have some information about that.
Yeah, thank you very much, Musa. No, unfortunately, I have nothing with me on Lebanon today. Sorry.
Thanks very much, Christian. I mean, I don't know if, of course, Ricardo or Jens maybe, but Ricardo did brief on Lebanon, as you heard earlier, and if you have anything to add, just put your hand up. In the meantime, what I would like to do is maybe go back to Satoko-san before we go to our guest who's joined me on the podium. Satoko-san, Yomiuri, over to you. Do you have a question? Not
yes,
on
thank
Ebola,
you very much.
Go ahead.
Yeah, I just want to follow up the U.S. membership at the WHO. Christian, you said that if U.S. remains further in arrears, their voting rights may be stripped in the next assembly, and that's what they decided. You are referring to the executive board or this assembly? Thank you.
Thank you. That was the assembly in their discussions. Yeah. So all member states.
Okay, I think that's clear. Thank you so much. Maybe, Musa, just going back to your question, it's an important situation, which we, of course, have briefed on, but for the moment, we'll just need to get some figures for you, and feel free to liaise with Christian afterwards, or as well with Ricardo or maybe Jens. There are updates from OCHA on the situation broadly in Lebanon. So thank you very much, Christian, for everything. Very pleased to have with us Dr. Prasad, Vinayak Prasad, who's the unit head of Tobacco Free Initiative at the World Health Organization, who's going to speak about World No Tobacco Day for 2026. Over to you.
Thank you and good morning, colleagues. World Tobacco Day happens to be on 31st of May. And just by way of reminder, more than 7 million people die due to tobacco every year. The theme for this year is Unmask the Appeal, Counter Tobacco and Nicotine Addiction. And for those who have followed World Tobacco Day, even last year we had this broad theme, but this time is a more targeted focus on the nicotine and tobacco addiction, the way the tobacco and nicotine industry have designed products to attract and add a new generation, largely targeting children. And this is happening because the way sugars, cooling agents, flavors, they all mask the harshness of nicotine and gets promoted through digital marketing, lifestyle choices, almost glamorizing the addiction of these products. And so it's, again, mostly happening because where tobacco consumption is now seen